Welcome everyone. So today we will cover another topic of pediatrics, and that is respiratory distress syndrome or haline membrane disease in newborns. So respiratory distress syndrome is syndrome which is characterized by deficiency of surfactant in premature lungs, and baby develops distress, and it is also known as haline membrane disease. Now respiratory distress syndrome is defined as respiratory distress caused by lack of surfactant, most frequently in preterm infants. So now what happens when baby are delivered before their before 38 weeks? So that baby will be preterm, and they those babies who are preterm do not develop surfactant in their alveoli of the lung. As what is the function of surfactant? Surfactant reduce surface tension of the alveoli and helps in gas exchange. So when surfactant are deficient, baby develops respiratory distress because they delivered prematurely in 38 week, and that premature baby will not have enough surfactant, and that particular disease known as respiratory distress syndrome means surfactant deficiency in preterm baby. Now pathophysiology behind respiratory distress syndrome is it results from deficient surfactant production, means surfactant are not enough, and in preterm babies. Now surfactant is produced by type 2 pneumocyte. Type 2 pneumocytes are the cells which produce surfactant in the baby, and these are cells which are present in pulmonary epithelium. Surfactant lining the alveoli reduce surface tension and improves lung compliance and prevent full or alveolar collapse during expiration. So these alveoli and surfactant play a lot of role in gas exchange in the baby. When these surfactant are deficient, baby develops respiratory distress syndrome. Now, when baby develops respiratory distress syndrome, so complaint will be hypoxemia, means decreased oxygen in the blood. Cyanosis, baby will be blue, and since fetal lung maturity is compromised, attained in 34 week, and gestation or respiratory distress syndrome develop in the baby who are premature, and these baby are more prone to develop respiratory distress syndrome. So in this way, baby develops respiratory distress syndrome when they are premature. There is no enough maturity, and surfactant deficiency is there, and baby develops haline membrane disease. So, risk factor for respiratory distress syndrome, the most important and first risk factor is prematurity. When baby is premature, respiratory distress syndrome most commonly can occur. Another is multiple pregnancies. Those mothers who give birth to the multiple babies may develop respiratory distress syndrome. Those baby may develop respiratory distress syndrome, and another is mother with previous preterm infant with respiratory distress syndrome, and the mother with diabetes mellitus, neonatal hypothermia, neonatal asphyxia. These are risk factors for respiratory distress syndrome. Now coming to the clinical feature of the respiratory distress syndrome, baby may develop tachypnea because there is deficiency of gas exchange, so that can create tachypnea, and the baby chest wall retraction can be there. Expiratory grunting or nasal flaring will be there in the baby. There will be sound, grunting sound, and cyanosis. Baby will be blue in the respiratory distress syndrome. So in this way, baby can develop respiratory distress syndrome. Now, how one can diagnose that this is uh, respiratory distress syndrome? For diagnosis, there is prior to birth fetal life should be assessed, and lecithin to sphingomyelin ratio should be less than in this disease it will be less than 2.1. So it by through this diagnosis can be made, and another after birth chest x-ray can be performed, which is diagnostic lab, and finding will be atelectasis, ground glass appearance in the lung, and air bronchograms will be there in respiratory distress syndrome. So once baby has developed respiratory distress syndrome, how one can treat this condition? Treatment is by management by supplementation of the oxygen in order to maintain oxygen in the baby, and continuous positive pressure ventilation technique is maintained with end expiratory airway pressure, and mechanical ventilation should be given, and exogenous surfactant should be administered in the baby of respiratory distress syndrome. So this was respiratory distress syndrome. In this way we can manage the patient of respiratory distress syndrome.